Hi there, my name is Raven, and I'm the host of Adventures in Nursing and Beyond. I'm a nurse who loves to help new nurses find their voice. You can find me most days scrolling Instagram for new recipes to try and helping my middle schooler conquer sixth grade math. But each week, I'll be popping into your ears to teach you how you can navigate your new nursing career and sharing behind the scenes on others who've done the same. So, there's one class I wish I had in nursing school, and that is how to supervise others. If you're a nurse long enough, at some point you will have to supervise others. In nursing homes, LPNs supervise the nursing assistants, med techs, and other support staff. Whereas in hospital settings, RN service charge nurses and nurse supervisors. So let me give you a quick definition of what a supervisor is. Two parts. Supervisor is a person who supervises a person or an activity. Also, it says a person who is in charge of a group of people or an area of work and who makes sure that the work is done correctly and according to the rules. So, in my opinion, nursing school prepared me to take care of patients, not to supervise others. Learning to supervise others came from on the job training, watching others, and seeing what did and did not work. I also remember how I would like to be treated. Here are some tips for you on supervising others. First and foremost, to be a great supervisor, you must treat your coworkers with a level of respect and realize that even though we have all different titles, initials, job descriptions, we each play a part in treating the patient. So we're all on the same team. You also want to make sure you lead by example and are always willing to help. Supervision, I'll be honest with you, is one of the things in my nursing career that has been challenging, whether I'm doing the supervising or I'm the one being supervised. So here's a little more information to help you get started. First of all, you need to know it all starts with you. Be serious about your work and be willing to help others. And it can be something as simple as just helping the nursing assistant pull up a patient. That goes a long way in building a good nurse and nurse assistant relationship. Also, treat everyone with respect. As I said earlier, you want to acknowledge everyone on the team, regardless of their title or role. Simply greeting others by name and asking how they're doing goes a long way. You want to make sure you're developing a good work relationship. Also, trade offs work well, and that looks like I need this done now. What can I do to help you get this done? Or can I take over what you are doing so you can complete the task that I requested you to do? Again, that looks like a patient is being fed and you have another patient who maybe fell down and needs to go to the emergency room. They have a procedure scheduled. There's something going on and you need them to assist them first. So, can I take over what you're doing, or what can I do to help you go do what needs to be done right now? Also, taking a few minutes to explain what's going on with the patient before asking something of someone is also helpful. Offer a simple explanation about why something needs to be done right away. Again, the ambulance is en route, they're 5 minutes away. Can you go tend to this patient now? And I'll help you whatever way I can. We can do it together. Or I'm doing paperwork, I'm finishing up the paperwork at the desk, and I need to get that done. Can you go and make sure the patient is prepared to leave, presentable, has everything that they need, working as a team, but doing two different tasks? Also, being a supervisor means from time to time you're going to have to counsel others. Now, my suggestion is to pull the employee to the side out of the earshot of others. And we're going to talk about it. Talk as well as listen to them about whatever it may be. Some of the things that have come up that I've had to offer correction on, maybe extended lunch breaks, going over on the time, leaving the facility, not letting someone know you're on lunch, simple things. Sometimes it's disagreements between employees that may arise, and they may, get into a little disagreement. You may have to separate and just tell them this is not the time and place for that. Also, when patients and family members make complaints about employees, you may have to address that with an employee. My motto is always ask, listen, and decide. So I'm going to ask questions. I'm going to listen to your answers, and then I'm going to decide based on what was presented to me and the discussion that we had what needs to be the next step. I also say do not approach the employee in a confrontational manner, as all this is going to do is escalate the situation. So, on another note, I found that to be effective at supervising others, it's also best to be friendly with your coworkers, but not be friends with your coworkers. When you need to counsel someone, you want to avoid showing favoritism. So, when you're friends with those who you supervise or supervise you, I find the lines can be blurred. So, setting boundaries with your bosses, managers, and peers allows you the freedom that you need to speak freely, voice complaints, and say no when needed. When there's a friendship there, sometimes it makes it difficult for you to say no or speak honestly and freely because you're thinking of the friendship level of the relationship. So it's just best when someone has I don't want to say power, but when they're your supervisor or you supervise them, you want to keep the relationship really light. You don't want to get too close so that you can maintain a good work relationship. So a great supervisor knows when to be firm and when to bend, can listen and deliver criticism as well as praise, which is really important. So I hope these tips have helped you and can direct you going forward in your nursing career. Make sure you tune in to next week's episode where we'll offer some more great advice so that you can be the best nurse you can be. I hope you enjoyed this episode of Adventures in Nursing and Beyond. Make sure to rate and subscribe to the podcast so you never miss an episode. New episodes are dropping each week, and I can't wait for you to tune in. Until then, have an awesome week.